Morning.
Morning.
There are two recommendations. Maybe? There are two recommendations that were addressed to the National Highway Traffic Safety Administration under recommendation number 3. Most of my focus will be about developing dispatcher-assisted CPR protocols. My suggestions will be slightly different from what the recommendations from the IOM were. So first of all, telecommunicator CPR works. It's almost a no-brainer. It's highly efficient, and the multiplier factor of training dispatchers is incredible. So just think for a moment that in comparison, and this is not an either or, but in comparison, if you train 10,000 lay rescuers in CPR, they may see one cardiac arrest victim. If you train dispatchers to provide good advice and train them to teach people to do CPR, you can train several dispatchers who will see and encourage multiple persons and multiple bystanders to do cardiopulmonary resuscitation. Also, telecommunicator CPR can be done, particularly in areas where there's already an established EMD program, can be done with little incremental cost. So TCPR, telecommunicator CPR, increases the rate of bystander CPR. It speeds the time to hands on the chest, and it increases the survival rate of patients with sudden cardiac arrest, if done correctly. So here's what we want when the call of a sudden cardiac arrest is made to a 911 center or to a PSAP. There must be a very rapid recognition of sudden cardiac arrest in just several questions. The dispatchers must be committed to having the caller get their hands on the chest in a very short period of time, ideally in less than 120 seconds, with consistent measurement and performance standards and benchmarking. The dispatchers must be confident and proficient, and the entire program must be accountable. The elements of a TCPR program are not complex, but they require a commitment and a culture of success in the PSAP and in the EMS system. Among the challenges, there are about 50% of the PSAPs in the nation that do not currently deliver TCPR instructions, about the same number that do not provide emergency medical dispatch at all. Of these PSAPs that are providing TCPR, most do not know how well they are doing. Let me just stress that, excuse me, delivering TCPR instructions late or poorly is like not delivering them at all. While perhaps under development, we don't currently have a national TCPR performance standard against which to benchmark performance. And my gut reaction is that TCPR by PSAP call takers is probably not high on most healthcare priority lists. Most do not realize that the potential return on investment of TCPR. I didn't in my former job, and I probably should have. There are potential opportunities to move the agenda forward. Could Next Generation 911 expand the number of PSAPs that offer TCPR? Next Generation 911 will provide the technological capabilities of rapidly and seamlessly transferring calls and data to specialized call centers. While every emergency call center needs guideline-based TCPR instruction every time someone calls for 911 help, perhaps, and just perhaps, if we expand the horizon just a little bit, not every call center needs to provide the actual TCPR call instructions to the caller. It's possible that CPR instructions could be provided by a regional TCPR center. Something for us to consider, something for us to bounce around a little bit. There will be lots of logistics to think about, but the concept may also be pertinent as we think toward the future and think about triaging of text and data to PSAPs from various medical devices and smartphones. And these are areas that may begin to rapidly overwhelm public safety answering points with data and specialized information. The increased use of standards development organizations may provide an opportunity for improved promulgation of TCPR throughout the nation. And finally, increased working relationships with state EMS offices, between state EMS offices and state health agencies at a state level will help to improve attention to the issues of sudden cardiac arrest within states. There are several possible paths to achieving wall-to-wall TCPR, and you will help us to brainstorm in the breakout sessions more of them. Here are a few. American Heart Association seems like the appropriate body to adopt the TCPR performance standards to allow individual agencies to benchmark. Developing 911 centers of life-saving excellence could serve as a gold standard for PSAPs to shoot for. Continued research is critical to including systems-level issues to help determine what really makes a difference. For the second recommendation that was made to NHTSA, including high-performance CPR into the National Model Clinical Guidelines and into the National Registry of EMTs Continued Competency Program would be a great start until the National EMS Education Standards are revised. And finally, rather than develop protocols and education standards, I recommend that NHTSA, through its Office of EMS and through its National 911 program, convene a national TCPR summit of key decision makers to create a TCPR national action strategy. This should culminate with agency and organization commitments to specific actions and address establishing the national expectation of TCPR every time a 911 call is, every time a 911 is called and TCPR is needed. This is an opportunity to bring all of the right players together through a culture of collaboration and to assemble the myriad of pieces in this jigsaw puzzle into a coherent strategy moving forward with a great degree of specificity. It's the right time frame, and I think it's an opportunity to make this a national priority. I think it's languished too long, potential is great, and this is an opportunity to move the agenda forward fairly quickly. Thank you very much.
Thank you.